Dear veterinary friends, welcome to Dr. Vet channel. I am Dr. P.R. Patel, Professor and Head, Veterinary Medicine. Today's topic is question bank number 7 in the subject of veterinary medicine. Question 1. Uremia. About uremia, there are many conditions which causes uremia in animal, and one of the diagnosis is urine-like odor on breath. There is a smell of ammonia, and this ammonia is created in saliva as a breakdown product of the urea. When more urea is accumulated in the blood, there is uremia. So uremia is an increased level in the blood urea and other nitrogenous waste products that are normally eliminated by the kidneys. Question 2 is important question. Type of indigestion in ruminants on excess proteinous diet. When animal take excess proteinous diet such as excessive legume grains contain protein, sometimes animal eat placenta that is proteinous. Answer is type of indigestion is alkaline indigestion. It is also called as ruminal alkalosis. In this, there is excessive accumulation of ruminal ammonia and nitrogenous products and a decrease in volatile fatty acids, leading to an alkaline pH of the ruminal fluid. So it is alkaline indigestion. Question 3. Groaning in pig. Sometimes the pigs, when they are in pain, they make a groaning sound. What is that? Pig make a low, short, guttural sound, and it often indicates a pain. Question 4. Vigorous indigestion in cattle. The major cause of this vigorous indigestion is traumatic reticuloperitonitis. Is very important. One and major cause is this TRP. Answer is the syndrome of vigorous indigestion is characterized by gradual development of abdominal distension secondary to ruminoreticular distension, and the cause or the result of lesion affecting ventral vagus nerve. Question 5, important question. Turpentine oil we are giving for the treatment of tympani. It is an excellent drug. This turpentine oil cannot be given alone. It must be mixed with large quantity of the edible oil. Important. Otherwise, it may cause irritation. The various uses and functions of turpentine for the relief of gas in tympani case are due to turpentine oil is irritant oil, so it induces motility. So to some extent, it is a ruminatorics and helps in expelling the gases. One thing. Second is turpentine oil is anti-zymotic. It controls the fermentation. That will help in less production of the gases. It controls the production of gas also. Third thing, it is a nauseatic agent. Its smell is very bad. So it causes irritation. That also help in removal of the gases. And it is a very good surfactant. So it causes breakdown of the gas bubbles and release of gas and irritation of gas. So this turpentine oil is very much useful for the treatment of tympan. Question 6. Drum-like sound on percussion of human. Answer is a tympanic note suggests the presence of free gas in the room, and that is called as free gas bloat or tympani. Free gas gives a tympanic note on percussion and a drum-like sound on percussion. Question 7. Dysphagia means difficulty in eating or painful swallowing, and the regurgitation of slimy material often mixed with blood through nostril indicate these are the characteristic sign of esophagitis. Question 8. Content of normal saline solution. We are using frequently in laboratory, also frequently using as intravenous. The concentration of sodium chloride is 0.85%. Question 9. Suprascapular paralysis in cattle. It is often known as slipped shoulder. It is due to injury of the suprascapular nerve, and that results from paralysis of supraspinatus and infraspinatus muscles caused by damage to the sixth and seventh cervical nerve. Question 10. Radial paralysis. It is also known as dropped elbow. It is due to injury to radial nerve. This paralysis is observed in cattle, horse and dog, where the animal is unable to bear weight. An animal stands with the help of knee and fetlock joint. Question 11. Motor irritation. What is that? Technical name is hyperkinesis. The answer is involuntary excessive movement caused by irritative lesions of motor region of the CNS. Motor irritation. Motor region of CNS affected. Hyperkinesis. Excessive movement of the muscle. Question 12. Infrared therapy and its uses. The uses of infrared therapy is it improves circulation in skin and other parts of the body, brings oxygen and nutrients to injured tissue. Thus, it promotes healing, helps in ease pain, it reduces pain, it relieves inflammation and protect against oxidative stress. Question 13. Frequently come across the word tonic conversion, clonic conversion, or tonoclonic conversion. What are they? The tonic and the clonic seizures, when start on one side of the brain, it is a partial or focal seizure. When it starts on both sides of the brain simultaneously, it is called as generalized seizure. Now, what is this again? Tonic and clonic seizure affect the skeletal muscles. The tonic seizures generally occur in tetanus, cause stiffening of muscles, while clonic seizure generally occur in strychnine poisoning and it causes a jerking or twitching movement of the muscle. Both tonic and clonic, that is tonoclonic seizure, occur in epilepsy. Question 14. Dog sitting posture in horse. The horse which become recumbent and cannot rise is also called a down horse because of underlying causes. The causes may be soreness in the back legs, that is very common, sometime in colic, and azochuria is the main cause. When the horse very tired, it also sits like a dog sitting posture. The dog sitting posture is generally due to middle back lesion of the result down horse. The horse sits up the strength of the forelimbs. It sits down on the hind limb and sits up with the help of the forelimb. And this type of posture is called as dog sitting posture, commonly observed in the disease azochuria. Question 15. Osteodystrophy fibrosa, also called as renal ricket. When there is renal disease, there is retention of phosphorus. So it is called as renal ricket. It is also called as rubber jaw. It is also called as wheat bran disease. It is also called as big head, also called as Miller's disease. Osteodystrophy fibrosa is a defective calcification of bone due to high phosphorus and low calcium, where the soft cellular fibrous tissue are laid down instead of the osteoid tissue. So the bone becomes more fibrous rather than more osteoid. Question 16. Photosensitization sometimes occur in animals. For the occurrence of this photosensitization, two conditions are a must. Photodynamic agent in the body, one condition, and second condition, exposure to sunlight. Many plants cause these photosensitizations are winter wheat in cattle, medicago species by alfalfa, hay or grass because of chlorophyll and porphyrin, pigments, brassica species, mustards, and commonly observed by consumption of the plants Lantana camera. Photosensitization is an increased susceptibility of skin caused by ultraviolet sunlight exposure and photodynamic agents. It is called PDA agents, photodynamic agents. These agents may be plant compound, aberrant pigments, and compounds that accumulate after aberrant hepatic metabolism. That is called as hepatic photosensitization. Types of pica. There are many synonyms of the pica: allotriophagia, depraved appetite, or perverted appetite. That means animal consume substances other than normal food. It is generally caused by phosphorus deficiency, mineral deficiency, when animal is given inadequate food, endoparasitism, chronic gastritis, and neurological disorders. Various types of pica are geophagia, when animal eating of soil and sand; pilophagia, eating of hairs; osteophagia, eating of bone; infantophagia, observed mostly in dogs, eating their own newborns; coprophagia, eating of fishes; licking disease, sometimes animal eat papers, clothes, stones, etc. Iron mongering, when the animal licks iron, metal, etc. Question 18. Chorea in dog. The chorea is a spasmodic twitching of a muscle or a group of muscles. There is no treatment of chorea. It is incurable disease. Now what is chorea? It is called as hyperkinesia. We have already seen hyperkinesia. Hyperkinesia, a disorder in which muscle spasms are prominent, and it is a sequelae of canine distemper or encephalitis. Question 19. Clinical classification of paralysis. What is paralysis? Paralysis may be a complete or partial or incomplete loss of nervous control of any body functions, mostly the muscles, and it is characterized by total inability to perform voluntary movement. The clinical classification of paralysis is, it is called as monoplasia, when there is paralysis of only one limb. Diplasia, when it affects both sides of the body. Hemiplasia, affect one side of body. Paraplasia, affect hindquarters only. And quadriplegia, when all four legs are affected. Question 20. Choke. Generally we utter the word choke. What is choke? When there is complete choke or complete acute esophageal obstruction is considered as choke. The esophagus is totally blocked, obstruction. Question 21. Normal pH of rumen fluid. It is generally neutral, but it varies between 6.8 to 7.2 pH. Question 22. Traumatic reticulitis physical test. For the diagnosis of traumatic reticulitis, the clinician performs certain physical tests. The important tests are reticular grunt test. When there is pain at the reticulum, percussion at the reticulum, animal grunts. Pole test, Witherpin test, Scutch test, slope test, Griffith-Sternman percussion test. These tests are used by the clinician for the diagnosis of traumatic reticulitis. Question 23. Shape of rumen in vagus indigestion. In vagus indigestion, we already see there is distension of abdomen due to distension of rumen. The rumen become characteristic apple-shaped or L-shaped. The ventral portion is more distended than the upper portion. Ventral portion is more than the dorsal portion. Question 24. Name disease in which abominism is placed at anterior part of the left flank. Normally the abominism is on the floor of the abdomen, but because of some disease condition, it may change its and migrate to the left of the rumen and may go up high up to the left flank. The condition is called as left displacement of the abominism. Question 25. Most common site for obstructive urolithiasis in male dog. Here we are talking about obstructive urolithiasis, not formation of urolithiasis, where obstruction occurs. The common site in dog are os penis and prostate gland. Friends, you have observed this video. Please share this to those who are appearing for the competitive examinations and requested to subscribe to support and promote the channel. Thank you very much for observing this video. Next time we'll come with question bank number 8 in the subject of veterinary medicine. Thanks.